The title of our panel session today is Communities Fighting Stigma. The Access, Identity, and Men AIM study, how South Asian MSM navigate their sexual and overall health, will be presented by Ramraj Sharvendiran from the Alliance of South Asian AIDS Prevention, ASAAP in Toronto. End-of-life concerns among older gay men, the pervasive influence of stigma will be presented by Patrick Aubert from SFU. The cascade of care in HIV-positive MSM in the Vancouver downtown east side will be Sahad Vafadori, and the uncommon ground ecologies of social differences in gay and MSM agricultural producers will be presented by Joshua Edward from UBC. Our first speaker, Ramraj Sharvendiran, has worked in diverse capacities over 8 years from queer communities across the Greater Toronto Area, from community radio to frontline outreach. Ramraj is currently the men's sexual health coordinator at the Alliance of South Asian AIDS Prevention, where he works with South Asian guys who like guys around topics of sexuality and sexual health. Furthermore, Ramraj was the nominated principal investigator on the Access, Identity, and Men AIM study, a qualitative research study that delves into how racism, cultural expectations, and gender impact health outcomes for South Asian men who identify as having sex with men. Please welcome Ramraj.
Cool. Hi, so ROM for short would be cool as well. For those of you who don't know ASAP, because we're based out in Ontario, we're the Alliance for South Asian AIDS Prevention. We've been around since 1989, doing work with South Asian communities across Ontario, but mostly within the Greater Toronto Area, around sexuality and sexual health. If you want more information, asaap.ca is where to go. Or find me, I'm here for the next 2 days. So I just want to acknowledge the 3 organizations listed there. So the Ontario HIV Treatment Network, which funded this project, Ryerson University, which provided academic support throughout, and ASAP, where I'm from, we kind of hosted it. This was our first research initiative. So kind of the breakdown, what I'm going to be talking about today is why we did the study, a few acknowledgements, talk about the research design, who we really captured in our demographics, some stats on like some of the behavior patterns of the guys that we surveyed, and the results of our qualitative piece, so the focus groups and interviews that we conducted, and then talking about the results and impacts. So why we did this study, the AIM study sought to kind of fill in a gap. So we realized that there wasn't a lot of research specifically focusing on South Asian MSM. Usually it was clumped into a broader category of Asian, which was like East Asian, South Asian, and a whole slew of folks, or just racialized in general. And it was really hard to find information on specifically South Asian men. So we wanted to fill that gap in research. And just because we've been doing this work for over 25 years, we didn't want to make assumptions about the communities we serve, and to accurately kind of adapt to the changes that were going on to the communities we serve. We wanted to really hear them out in a more formalized manner. Also a way that we can use this information to share with other service providers that are reaching these populations. The research team was myself, the nominated PI, Dr. Trevor Hart and Vijaya Chikramani were the co-principal investigators. Haran Vijayanathan, Zavari Tengra, and Anthony Bacchus were our co-investigators. Samir Durrani was our project coordinator, and Raheem Thawer and Sujeevan Chandrakumar were on our community advisory team. These are some of the community partners that helped us reach our target populations and formed the, helped formulate the questions and stuff. We kind of like ran our support groups out of some of these centers, or we asked them to do some outreach for us and asked them to give us their feedback on the research we were doing. So we formed the team. We went through the ethics approval at Ryerson, and I had to go through that strenuous process, and I don't come from a research background, so it was very much a learning curve for me. Recruitment was also a major part of it, data collection, coding, analysis, and then now we're in our KTE part of the situation. So as far as the research design is concerned, we took a mixed methods approach, I'm told, of quantitative tools surveying knowledge and behavior. So what we did was every focus group or interview we conducted, we gave them a survey to start off to kind of capture some information that they might not be willing to disclose in an open setting with a facilitator. So how many times were you engaging in particular sexual activities with or without a condom? How many times have you gotten tested? How you identify? Things that, you know, we were kind of flagging as people might be a little weary of sharing that to someone in person, but on an anonymous survey, it might be cool. We conducted 12 focus groups and interviews across Toronto, Scarborough, Peel, and York region, serving 39 South Asian MSM within the GTA and 9 service providers who kind of work with South Asian MSM populations or work with South Asian populations in general and might not be aware that MSM were a part of their catchment. The information we're talking about today is really focused on the 39 South Asian MSM. I know it's a smaller number, but it's what we did. So as far as demographics are concerned, the 3 major regions of origin folks identified with were India at 59%, Sri Lanka at 17.9%, and Pakistan at 15%. Religious affiliations were topped off at Hinduism at 48.7%, and Muslim at 28.2%. And the 3 top languages outside of English, all the interviews were conducted in English and the surveys were. There was some translation assistance with some folks that struggled, but I think it was like 94%, yeah, 94% spoke English fluently. So the 3 major languages that were captured were Hindi, Urdu, and Tamil. This is a breakdown of region in the Ontario context, which might not be as relevant here. As far as income brackets, sorry if the numbers are kind of small. The major income brackets were below 20,000 and 40 to 50,000. And I think it was like 2% of the folks were actually born in Canada, most outside of. So some of the behavior snapshots that we covered, folks engaging in vaginal intercourse. Just to put this out there, we also captured whether the folks identified as cis or trans, and 100% of the participants identified as cis. So vaginal intercourse without a condom at 6.4%, with a condom at 12.8%. Anal intercourse topping at condomless at 23%, with a condom at 49%, and condomless bottoming 41%, and with a condom as a bottom 44%. And then the other 2 points were if you engage in oral sex, we also captured with or without a condom, but just for the purpose of this presentation, I focused on 90% of folks that they engage in oral sex, and then other activities like mutual masturbation and whatnot were at 85%. Okay, so this is kind of the more qualitative and fun part. So a major part of the focus was, this was the first research project that we had done, and because it was a CBR grant, we really needed to focus on building capacity within staff and within community members. So throughout the team, throughout the process, the entire team was offered training opportunities on understanding qualitative coding and analysis, putting them through workshops, grant and report writing, focus group facilitation and interviewing, going through the research ethics process, and we just really wanted to make sure that everyone didn't feel like they were lacking the language or the skill to participate in this research. So within the co-investigators and within the community advisory team, we really focused on trying to make it as accessible as possible throughout. I mean, there's obvious certain limitations to that, like the populations that we're reaching and that we were communicating with, but that was kind of an underlying goal that we kept throughout. So we set up a socio-cultural context. The last time I had to say that word, I kept tongue-tying it, so hopefully I won't today. So these are some of the criteria that came up as, hey, this is the reality we're in, and then I'll talk about the themes that came up as the major ones after. So within the reality that they were in, sex was seen as taboo, especially outside of heterosexual marriage. There was a lack of positive representation of homosexuality within religion that fed into narratives of homophobia, both internalized and like external, social. But what was really interesting is because we always jump on this bandwagon of it's always religion, it's always negative, and there's a separation between homosexuality and religion. It's a common theme that comes up in our conversations, not within just this intersection, but throughout. But what was really interesting was throughout the conversations, a lot of folks were citing religion as a source of strength and community for them in their own personal ways. So whether it was like a spirituality piece that they handled religion on their own, or if they connected to religion in a way that was separate from the sexuality, or that they were fortunate enough to have that intersection work out for them, and their religious communities were there. And we thought that was really important to mention because often there is this separation and there's this disconnect in that conversation. But, there were folks in this group that said, this is a source of strength. And then another part of it was being gay represented a sense of shame and embarrassment, which is a constant theme that we see in the work we do, for both family, immediate and extended community, and the individual on an internal level. So some of the quotes, and forgive me when I'm reading these quotes because they were verbatim from the transcripts, and so, yeah, bear with me. Being gay is not acceptable in society where I'm from, and it is considered taboo over there. And so we have we have strong cultural values, and religion plays an important role in my society. All of the men, he get married, and they have children, but it's kind of very complicated, and we cannot afford to be open because it may involve the risk of losing your family, and so it's kind of very complicated. Knowing all the while that I had homosexual inclinations and attractions, I acted on them. But every time I did, there was a deep sense of sin and guilt about what I was doing, and it took me a long while to come around to recognizing that my homosexuality was really something dignified and pure and loving and worthy of acceptance. Like when a religion like Islam says homosexuality is wrong, the same religion says that whatever is in your heart, you don't have to say it to God. God knows already. So a few other points to the socio-cultural context. It's already starting. Expectations played a huge role in that. And so if you were failing expectations, cultural expectations, expectations of your family, they included getting married, having children, not just adopting or surrogacy or any of these alternative methods, not alternative, any of these things. Anything about having children outside of a heterosexual marriage was deemed as not existent or like failing to meet that expectation. Effects of these expectations, many of them felt unsafe to be out in their own communities of origin. There was a lack of gay or MSM support within their own communities of origin. And there was a sense that, like a lot of the folks, because most of the folks came from outside of Canada, that, coming here, Canada was relatively safer for gay men, but that wasn't always the case. So some folks said that, their communities back home, actually they felt more comfortable in there. And there's other factors into that, like racism and things like that were playing out, and the whole settlement process. I'm going to skip some of these quotes just for the sake of time. And the last part on the context that we set up. So most folks identified with 3 different realities, and some was a combination of the 3. So one, it's a difficult life is how we titled it. We're lacking some creativity there, but bear with me. Difficult to discuss being gay with anyone, finding specific people to connect with, often other gay men, having a sense of shame kind of going on throughout, and a sense of social isolation was there. Compartmentalizing identities is not seen as difficult. So choosing spaces to be gay and places to be silent, it's a reality and not something to be freaked out about. So this was really important because it kind of like combated that whole, you need to come out in order to live your authentic life, and this whole like pressure to come out, which a lot of folks put out there. But then throughout that, like as much as folks acknowledged that that was kind of a pressure that existed in more mainstream spaces or in general, that, hey, if this gay word comes up or if anyone clocks it, they're like, hey, have you come out yet? It's gonna be great, it's gonna be amazing. And folks were just like, chill, hey, like I'm managing this the way I am and I'm used to this and this is a part of my life and I'm okay with that. I'm out in certain spaces, I'm not out in others. I'm maintaining the relationships I want and how I want to, and this is my choice in how I'm operating that. I don't need judgment on it. And that was a really important thing that came up with a lot of the men. And then the third kind of lived experience folks identified it was with, I'm out in all places, and so I'm out as South Asian, I'm out as gay, I can live that intersection, live that authentic life. It wasn't the majority of the men in this context, but it was one of those, it was one of those pieces that folks were like, yeah, I refuse to be in the closet. Again, it wasn't the majority of folks. The majority of folks fell between the first two, but the third, it was there represented. So the act of coming out really, the act of coming out is really impossible. And I'm out to my children, I'm out to that nucleus of mine, but I'm not out to the community because it's stigmatized. Okay, so when we collected all the data, 8 minutes, okay, we collected all the data, we separated into 4 themes. Relationships and community, mental health and social isolation, no, that was the word I screwed up. Navigating sex, HIV, and health. So when we talked about relationships, many men came out within white spaces, so mainstream LGBT spaces. and they wouldn't necessarily get to connect with other South Asian men with the same kind of lived experience, being gay and South Asian, until later on in life, until they've already come out within this mainstream community, kind of check their South Asian identity at the door in some cases, and then later on in life somehow they're able to connect, and they were like, oh, this is a whole other level of connecting to community that I didn't realize was there. Despite silence around sexuality, cases of homophobia within the South Asian community, many men found support amongst other South Asians. I'm going to touch on that a little bit more in a bit. Few prefer to interact with folks outside the South Asian community when they realized that there was this queer South Asian community. They're like, I'm kind of happy here, I'm kind of comfortable here. There's a certain level of understanding that I'm not getting outside, so I'm kind of happy when I find that. Men definitely identified there was a certain amount of stigma with their sexuality between how folks were identifying themselves and then their sexual practices and things like that. And some identified experiences of violence and fear of violence, both within relationships and without. Or, because at times life can be really lonely as well. We all know that, right? And it's just to have friends. You understand your situation, especially South Asians, it's huge. That's huge. So yeah, just being there for a lot of people helps. Mental health and social isolation. Men reported having anxiety or depression, and they cited 4 different areas where it came from. So either they were lonely, that social isolation piece, there was rejection from family, or there was a fear of family rejection. That fear of family rejection fueled a lot of different behaviors, not different, I feel lonely because I'm afraid to come out, because I'm afraid of my family rejection. That fear was real, and then just that general stigma which kind of fed into that. Social isolation, some men described their feelings of isolation as feeling like there was no one else out there, that fit that kind of intersection. Men seem to feel pressure to marry or engage in heterosexual relationships, either to address social isolation or to meet family expectations. So this idea is really common within the community. You're going to get married regardless of your orientation to another woman to kind of fulfill that obligation to your family. That is, that is a lived experience that's there. But a lot of folks are saying that they wanted to do that because they just didn't want to feel alone anymore. So it wasn't necessarily just the family pressure to get married. It was that if I marry somebody, I'm with this person, then I'm also not alone anymore. And I don't feel as isolated, because right now I'm not being able to connect with this gay community that might exist. I'm not able to connect through the avenues that I have available to me. So getting married makes me feel a little less alone. And it was something that folks kind of throughout kind of had this weird struggle on how they were going to do that, and if they weren't married yet, that they were really considering it because of that reason. And that was kind of new to us, because we understood the fact that there was that family pressure, but this idea that this was going to be their solution to feeling lonely was kind of newer information. Sex was also seen as a means to address social isolation. So a lot of folks, when they were going on the apps, they're on Grindr, they're on Plenty of Fish, they're on whatever they were on, it wasn't necessarily looking for sex, but they would use sex as a means to kind of have a social connection and relationship. So a lot of the time folks would put themselves in relatively precarious situations because they just didn't want to be alone. They were at home and they wanted to connect with somebody, and the only way they were to get someone to just be there with them, just be in the room. One guy almost started crying, and he was saying, I just want someone to watch television with, in my room with. Even if it's after sex, that's all. I don't even want the sex. I just want someone to be there with me, because I can't just be on my own, and I don't like it. Okay, let's keep going through these. So navigating sex. Men described their experiences of gay spaces as being predominantly white, being completely out, didn't overlap with their own realities, and so it was really hard for them to jive in certain spaces that, this idea that I need to be out and everywhere, and that if I show up there, people are going to assume I'm not out, and one, there's going to be a lot of guilt with that if I'm not out, I'm not going to really fit in and navigate those spaces. As for racism, which was something we really were looking to capture or flag throughout the study, it was really interesting in how it was kind of depicted throughout the transcripts. So a few men reported no experiences of racism. However, others talked about this feeling of invisibility in gay spaces, but they didn't really use that particular language of oh, it was sexual racism, oh, it was this and that, and we weren't expecting them to, but we were just trying to figure out where these markers kind of were lying. Many linked online spaces to more overt sources of racism, such as racist or exclusionary language in their profiles. And some men reported that they felt that their options were limited and that they needed to seek sex where and however they could. So, you know, feeding into that whole precarious situations for that chance of intimacy. I always want to use a condom. I would say it's harder, especially if you feel that somebody of a different race actually is or are a more privileged race. As such, you're negotiating sex with them, or you feel like, okay, he looks better or whatever, I don't want to lose this chance of actually hooking up with this person. So this idea of like, hey, I might not use a condom in this situation, even though I might feel I need to. If I'm losing this hookup, I'm kind of screwed. They treat you like an exotic person because you're like that, right? They don't really see me, you're just kind of like, they don't really see me as a normal human being. Sometimes they'll say, okay, you know, like how exotic this person is, maybe because they're like South Asian or they're brown or whatever, but so there's still elements of racism that are prevalent, even when some people put on their online profiles like no Asians or no South Asians or no blacks. So I don't go out, but back in the day when I used to go out, like clubs and parties and stuff, I would find when there were large pockets of white people, they just won't look at you. Like in a club situation, there'll be large pools of white people, and either they won't look at you, or if they look at you, it's kind of like they're tolerating you, not necessarily accepting you. And so the last theme I want to touch on is sex, HIV, and health. Sexual health wasn't top of mind in conversations in the focus groups unless we kind of had the question that kind of probed it. So folks weren't naturally kind of segueing to any of that stuff. Some men stated that they didn't experience any barriers to accessing service, while others identified 3 areas: language barriers, shame and disclosure, and location and proximity to services. So some folks were, let's say, in some of the suburb regions, and they felt like they weren't going to get that kind of queer-specific counseling or services that they would they would get downtown in those like in the suburbs. And so a lot of folks also talked about how this wasn't necessarily something they experienced, but they have friends that experience this. Not sure if they were just being like, hey, I have a friend, or if it was actually the case, but it was a little bit of both in some cases. Disclosure of sexual identity in HIV testing. Disclosure of sexual identity in HIV testing, especially in the context of a family GP, was cited as difficult. And this is not something that's a surprise, this idea that, you know, you see the same doctor that your family sees, someone might say something even though they're not supposed to. That was a common barrier for folks. While men stated that they accessed HIV testing, they also acknowledged gaps in testing amongst others in their communities, especially in the back home contexts with peers in the diaspora with varying levels of education and language skills. So they were saying that, you know, in the back home context, testing may not have been major in whatever community they were coming from. And so when folks came here, unless they had like kind of access services or knew what was available to them, they weren't really accessing testing services and things like that because it just wasn't in their atmosphere. They just didn't have access to it. Things weren't like targeting them directly, and so they just didn't know that they should be getting tested. Condom use cited as common here, but again, in the back home context, sometimes condom use wasn't as the norm. I think I'm done, right? Do I have a second? Okay. Let me just run through this. So some of the major impacts we made for, so a lot of the communities that we reached were folks that we didn't actually serve within our service population. I think initially we thought a lot of the folks participating in the study were folks that were already accessing our services, which we thought to be a huge drawback, but there was a snowballing effect with people referring others to come in, and they were like, I didn't realize I can come and talk to folks about this. And so a lot of folks were really like, they were really owning that space. We had to start cutting people off because they started talking and they were like, I never get to talk about this anywhere else. This is amazing. So we were able to provide a lot of referrals to like our 3 support groups that specifically deal with MSM populations. Also to some counseling services and things like that, as like, you know, certain things were disclosed in some of the sessions. We were able to provide a lot of referrals to folks that just really never access services, at least to our knowledge in that space. And we increased our in-house capacity as research. So this is the first time as an agency we were able to lead community-based research project or any kind of research project. And so now since then we've been able to lead 3 other projects, I think. And so it's been a huge investment in our own capacities, and a lot of the community folks that were involved have used that, have leveraged that in really cool ways. And implications going forward, continue to promote, like, these are things that we kind of did as an agency, so that's cool, we can skip that. There's my contact info. I'm around after if anyone wants to talk. But yeah, that's it for me. Okay, cool.